Hello, I'm Dr. Brandt Gibson, and one of the conditions that we see in children a lot of times is a condition called webbed toes or syndactyly. And syndactyly is basically a fusing the toes. The skin between the toes actually fails to disappear or degenerate in the in fetal development, and it can occur as often as 1 in every 2,000 to 3,000 children born. Most of the time it's just skin, but it can be more severe. You can actually have syndactyly, or the webbing of the toes, where the bones are actually fused, or you can have blood vessels that are going in there, or muscle or nerve issues that are going on there. It can happen because of other syndromes, such as Down syndrome or Apert syndrome, that can actually cause this. But a lot of times the webbing of the toes is asymptomatic, doesn't have any pain or any problems that way, and may not be a huge issue that needs to be treated. But it really comes down to if it's symptomatic or problematic enough that it should be treated. So if your child has webbing of the toes and it's problematic, it bothers them or causing issues or so forth, then it can be fixed surgically. And really what you do is you go in and you actually separate the toes in the area, and as long as it's really just skin, that's a relatively simple process. If there's nerves or blood vessels or bones that are involved, it may take a little bit more to do, but it can be fixed, and most of the time the recovery is relatively quick, depending on how much of webbing needs to be fixed. So if you have webbing of the toes, it doesn't have to be treated, but it can be treated if it continues to be a problem, or if it creates any issues that way. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 304.